My name is Michelle Trotter, and I'm Business Development Specialist here at Eagle. As the coronavirus continues to rapidly spread across the United States, we know you're faced with fear and uncertainty, but we want to let you know that we're here for you. Our scientists are here to answer any questions and concerns that you might have. We also want to educate you on some tips and some information to keep you, your family, and your businesses safe. As of April 3rd, 41 states have issued stay-at-home orders, resulting in many Americans now working from home. However, essential businesses like pharmacies and other health-related services continue to operate. So how do you protect yourself if you're one of those who has to leave your home to go to work? Our expert in Washington, D.C., Dr. David Husong, breaks down some tips to protect yourself while you're in public.
At this point, with the prediction that the infection rate will be peaking in the next few weeks, it's probably a very good precaution to start wearing a mask that controls droplets or particles. The better the mask, the more protection. So if you're in an area with a high infectious rate, then it's recommended first just stay home. If you have to go out, wear some kind of protection. And if there are many cases in your immediate area, then you should wear the best mask available. There's a lot of information recommending a simple bandana. And if that's the best you can get, please wear something. Definitely it's needed to have some kind of protection because the public needs pharmacists to provide the other drugs that patients need to get by. Protecting themselves includes the common sense hygiene, wearing masks as necessary, gloves when dealing in close proximity with people, especially dealing with people who say they feel like they have a cold. It could be flu, it could be just a basic cold virus, or it could be the start of a coronavirus.
We asked Dr. Husong to share some additional precautions that can be helpful for people to take.
You can wipe down all the surfaces, door handles at the house. I recently received some packages. I had a spray bottle with hydrogen peroxide and I sprayed down the cardboard. You can find more instructions online on what to do when you receive material that might be contaminated from the public.
A recent article in the Journal of Hospital Infection summarizes various chemicals for disinfecting surfaces that may have come in contact with the virus. Dr. Husong breaks down the different chemicals that can be used and how long the virus can last on surfaces.
It's a review article, and it's describing these information based on a number of studies. It also summarizes the effectiveness of various materials, chemicals, for disinfecting surfaces that may have come in contact with the virus. So the virus can last for a number of days on various surfaces and remains infected depending on the amount of virus got on there. Should you have suspicions about surfaces in your pharmacy or in your home, door handles are a prime example, surfaces of areas with public exposure. The primary disinfectants described in the article include ethanol to about 60 to 70%, and 0.5% hydrogen peroxide. They discuss benzalkonium chloride and 0.02% chlorhexidine digluconate, although they're less effective and not available in the average household. So if you've got materials in your pharmacy, hydrogen peroxide, for example, is available on the shelf at about 3%. So dilute that sixfold and apply it to the surface. The SARS-CoV-2 virus is a typical respiratory animal virus, and it has a glycoprotein envelope. That envelope is easily denatured with alcohol. The lipid will be extracted. In the case of hydrogen peroxide, that oxidizes the receptors from that virus particle. And those are the little buds that you see in advertisements and internet pictures of the virus. Those are protein and they're burned very easily. You can also prepare a very weak solution of sodium hypochlorite, that's bleach. A 10th% sodium hypochlorite is also effective, but it might leave a mark on your clothing.
Stay tuned next week for another episode of Eagle TV, and also if you have any questions that you'd like Dr. David Husong to answer, you can go to our website at eagleanalytical.com/COVID-19.